expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. Today we have returning Dr. Sandhya Pattem, and she is at Jupiter Gardens Primary Care and Anti-Aging at 175 Tony Penna Drive, Suite 101, Jupiter, Florida 33458. Her phone number is 561-746-2033. Website is www.jupitergardensprimarycare.com and info@jgpcp.com. Thank you so much, Dr. Pattem, for joining us on the show today. We appreciate that. How are you?
Thank you so much. I'm good. How are you doing?
I'm doing very well. Thank you so much for coming back. We know you have such a busy schedule, and we appreciate you sharing all your knowledge with our audience.
Thank you for having me once again.
So, you just have such a detailed background. I don't really want to miss absolutely anything about your background. I know that you are board certified through the American Board of Family Medicine, but if you could just give us a little more information about your background and how you started in the medical world.
So I've been practicing a family physician for about 17 years. I did my graduation from India for medical school.
Nice.
And then moved to the United States for public health masters. I completed a degree in public health at the University of Birmingham.
Mm-hmm.
And Michigan for my residency education and completion. And then started practicing in South Carolina.
Nice.
So for over a decade in South Carolina, and then moved to Michigan about three and a half years ago.
Now, I think you have some experience in geriatric as well as urgent care settings. Tell us about that.
Yes. So I've done a lot of moonlighting and freelancing at urgent care centers, and worked as a medical director for a few nursing facilities in Greenville, South Carolina. And also did hospice simultaneously while I was working with the nursing facilities.
Wow.
I served as a medical director for a hospice facility for over 5 years.
You know what I love hearing about when I speak to doctors, when I hear that you do different, just go into different things like urgent care, geriatric, hospice, I feel like it really makes you a well-rounded physician. I would imagine you've experienced so many different scenarios. How do you feel doing all those different positions has helped you serve your patients?
I think we understand complexities of medical conditions better. I think more so when you deal with a lot of geriatric population, because you have more complexities in that age ranges than younger age groups.
Yeah.
It has definitely given me an edge to manage and handle complicated cases better.
So what's the age range of your patients that are coming to see you over here at Jupiter Gardens Primary Care? What would you say the age range is?
I probably would say it's predominantly geriatric. Above 65 patients would be about 30 to 40%. I would say
Okay.
another 25% would be between 50 to 65.
Okay.
Another 20% I probably would think it would be younger. Getting a lot of younger patients now. I think Jupiter is becoming a lot more younger. Probably
It's
was not so before.
it's becoming much more populated, so I would imagine, yeah.
True.
Yeah.
So I do have a very good mix of all ages. Very few kids about 15 to 18. Haven't really been
Okay.
accepting too many kids because I don't do vaccinations in the office, so I discourage having them come and see me
Nice.
prior to 18.
And so what type of insurance are you accepting?
We do take most of the insurances, most commercials, Aetna, Blue Cross Blue Shield, United Healthcare, Cigna,
Oh, nice.
Medicare, some of the Medicare commercials. So, but for the most part, we have them all. Humana.
So, Dr. Pattem, what would you say is a pattern or something that you frequently see in the population? Is it high blood sugar levels? Is it obesity? What would you say is the predominant, circumstance that people are common thread that people seem to have nowadays?
I think we all know and accept the fact that obesity is on the rise
Yeah.
across the world. I
Yeah.
think just in the last 2 decades, I think there is a lot of prevalence of obesity and overweight in the United States. We constantly see people struggling to get rid of the weight, which can cause and lead to other medical conditions like
Right.
hypertension, diabetes, and multiple other comorbidities, sleep apnea, joint pains, osteoarthritis.
Yeah, it seems to be more prevalent nowadays. And so, what are you recommending as far as a plan of action?
I think lifestyle changes come across first when you think about it.
Good.
So, regular preventive health checkups, at least yearly or bi-yearly labs, once every 2 years to every year, blood work to include a comprehensive panel, at least a CBC, a chemistry, hemoglobin A1C, a lipid profile, and a thyroid profile are something that we recommend. There is a lot of prevalence of vitamin D deficiency across board,
Oh,
and that
yeah.
probably is also not a bad one to be checked. And we have been seeing a lot of rise in pre-diabetes and diabetes with the increasing weight gain and obesity across the board.
So, can you speak into a little bit more about A1C levels? Why would people, what is that? What is a test? And why should we get an A1C test?
So A1C talks about diabetes and pre-diabetes.
Okay.
As we talked, the increasing prevalence of weight and obesity is causing a rise in increasing A1C levels, more of pre-diabetes burden. Weight can actually cause a lot of insulin resistance where your own body's insulin is not working very well. And then you see sugars rising up.
So, does an A1C test evaluate back? How far back does it test your blood levels? Is it a
So A1C could aggregate for 3 months as to how your blood sugars have been running.
okay? So that's good to know. So you'd get an average of what it looks like over the last 3 months. Is that right?
Yes, and that's correct. Yes. So
So,
any,
uh
you were about to ask a question.
yeah, I was gonna say. So, um, I keep hearing, maybe you can clarify. I do hear a lot of people talking about this new medication. I don't know if it's called Ozempic or semaglutide. is that for people who are pre-diabetic or diabetic? Can you speak into that?
So, semaglutide falls into a group of medications called GLP-1, and there's another new medication called tirzepatide, um, which also falls, which is a dual peptide, which also has GLP-1 and GIP-1. They were originally released into the market for diabetes treatment, but they are found to have a profound effect on weight loss, both the medications. And that's basically how semaglutide got an off-label indication initially on, and now it's also indicated for weight loss with a different brand name.
I see. So I would imagine going to see you, people would be able to find out if they're a good candidate for this type of medication for weight loss?
Yes, it depends on the target weight loss as to how many pounds they have, and they have been found to be very, very profoundly effective in weight loss.
Is there an average weight parameter that one would need to have before you would decide to put them on a medication like that? Would they have to be overweight a certain amount of pounds, or how does that work?
So it's basically insurance driven. So the
Oh,
branded is not really
interesting.
covered by insurance for the weight loss or the BMI indication at this point. Some plans are covering, but very, very few, and we get a lot of pushbacks from the insurance. But if they do have an A1C that qualifies for a diabetic range, a lot of
Okay.
insurance, especially the commercial plans, are covering, and Medicaid also has been covering pretty well.
Oh, really? Interesting.
And
So,
it does give the added benefit of weight loss as well, along with the diabetes.
so Dr. Pattem, how are people responding to your lifestyle changes and suggestions? What would you suggest for someone who's maybe 20, 25 pounds overweight and they want to, change maybe their, lifestyle? How are they receptive to that? Are people actually responding well to your advice?
So, yes and no. It
Okay.
all depends. So some people actually come to me with a plan of action in their hand.
Okay.
I do tools and I challenge them, do this for a month, and then we'll see if we have to put you on any medications. And they do actually take it pretty well. And I give them some tools before they go out. We kind of educate them on dietary options, food choices, calorie restriction, exercise, and high intensity exercise regimens.
Okay.
And they do pretty well.
I'm glad people are receptive. There's so many, like you said, the hypertension, the high glucose levels. I know a lifestyle change. It's not always easy, and sometimes maybe hearing this type of information could be a motivating factor, right? It's a shift in perspective.
Definitely. I think diabetes diagnosis has a profound effect, and people are very motivated to make lifestyle changes. And even blood pressure. And we see a significant drop in A1C and blood pressures, even with a 5 to 10% decrease in weight.
Really, that's good to know. So even people thinking, well, I've only lost, X amount of weight. I think it's still a motivating factor if they're going and they're trying and it's moving in the right direction. I would imagine that, it would support them to know that you're there being a stand for them. And I'm sure that's what they need.
A lot of bariatric physicians and even some orthopedic physicians tell them that they don't want to do a knee replacement or a joint replacement or even a bariatric surgery. They don't lose about 15 pounds by themselves.
Right.
I think is a good strategy to kind of begin with because you want to actually have patients understand as to how difficult it is to lose weight versus how easy it is to eat and gain the weight.
Oh, absolutely. What do you tell these women who are maybe in their 50s and their 60s and they're into menopause and so many body changes? What can you tell us as far as a glimmer of hope of some change that we can embrace menopause and live healthily? What are some suggestions you would tell us?
I think that is very, very individually tailored to the kind of
Sure.
symptoms you're experiencing.
Sure.
Yes, there are multiple options out there. There are bioidentical hormones if somebody's experiencing menopausal symptoms.
Okay.
Yes, we are having increasing insights and education about how menopause and perimenopausal hormone imbalances can affect every aspect of your life: your sleep, your fatigue levels, your energy levels, your
Yeah.
skin, your hair loss, moods, brain fog. So it has a profound impact on all of those. So there are multiple options out there. Weight gain is also one of the changes that you see in perimenopause.
Are women coming into the office requesting more information about bioidentical hormones?
Yes, definitely.
Okay. Good to
You
know.
find out that they want to come in. They want to be educated. Not everybody's ready. They want to be educated. They want to be tested to see where they are with the
Okay.
hormones. And we tailor and customize an individual formulation for them that will help their
Nice.
symptoms.
What would you suggest is a good age to get your baseline hormones checked?
That's based on your symptoms. I would not
Uh-huh.
really say this age because everybody's different. So some people
True.
actually have menopause, if they have had a hysterectomy
Right.
and if both ovaries removed very early on, like even 32, 33, they experience menopausal symptoms.
Wow.
And some actually go into menopause mid 40s. A good predictor of as to when you can go into menopause is basically when your mother actually had a menopause
Okay.
or
Interesting.
symptoms.
Sure,
Based off
sure.
symptoms, you also check their hormones to see where they stand. And I think as we are moving into early menopause, as does we're moving into early menarche. So we
Yes.
see a lot of young girls actually having their cycles very early on by 10 years, 11 years of age. In the same way, we're also seeing a lot of early menopausal symptoms where people are actually having menopause by 42s, 43s. And I'm surprised actually. I had a patient who was like 41, and I didn't believe. And she didn't have any hysterectomy or she didn't have any other procedures done. She was in
Wow.
menopause.
Why do you think this evolution and this change is happening now?
I think lifestyle. The biggest thing
Life
is lifestyle. Lifestyle, the
lifestyle.
food, the toxins, the environmental toxins, the pollutants that we're being exposed to, so it's everything. The epigenetic factors, we're
Right.
just like web of toxins and pollutants and radiation, and I think all of those are causing some changes overall
Oh, yes.
to
Absolutely.
how we are evolving, and we don't really know clearly as to what's happening and why is all this happening. It probably may take a few more years, some time to come before everything would be a little more clearer.
I love that you are doing everything from the bioidentical hormones to traditional, treatments and testing. And then on top of it, you're doing the anti aging. So it's kind of like a one stop shop where really people can go see you and experience different needs that they want met. They can have met at your facility, and I like that. And there's not a lot of primary care physicians that are doing what you're doing, so we appreciate that.
Thank you.
Yes, definitely, for sure. So maybe we can speak a little bit into the anti-aging. What types of procedures are you doing there as far as anti-aging?
So my anti-aging component basically is primarily bioidentical hormones, medical weight loss assistance, um, facial aesthetics, Botox, dermal fillers,
Okay.
and therapy for facial aesthetics. And I do a little bit of PRP for joint rejuvenation and hair rejuvenation.
Wow. So does that works well for hair rejuvenation as well, huh?
I think it works very well for hair rejuvenation. It became more popular, I think, initially for hair rejuvenation and then probably for facial aesthetics.
Okay, interesting. You want to share with the audience a little bit about how the process, how that works? Because people are wondering, PRP, what is that? So maybe you can explain a little more in depth about what PRP is.
PRP is platelet-rich plasma. So we take your blood, we spin it through a specialized machine, and then you actually get something called liquid gold. So all the RBCs, the red cells, settle down on the bottom,
Right.
and the plasma settles on the top. And that actually has your platelets, which is rich with all the other micronutrients, plasma,
Right.
and the natural growth factors. And then we inject into your hair or your face, and then do some microneedling, which also serves as a facial kind of a thing.
Now, I've also heard of some people maybe is I'm not sure if this is correct for their joints or other parts of the body that may be beneficial to their body. Is that correct?
I think there is increasing body of evidence, especially for the joints, that it actually has beneficial effects. I don't think literature has proved that there is new regeneration of cartilage, but there
Okay.
is resolution of symptoms and improved pain symptomatology, even at the end of 1 year after giving the injections. So a lot of orthopedic physicians and pain physicians are using routinely in their practice.
Oh, okay.
Again, it's not covered by the
Nice.
insurance, and that probably is an impediment for people seeking out for these procedures.
Oh, that's what I was going to ask if insurance does cover that. So that would depend on their insurance policy?
I don't think it is actually FDA approved yet, so I
Okay.
don't believe that insurance is covering any of these procedures yet. So
Okay.
it may be or out of pocket cost for the patients.
Okay. Down the road, I think maybe once there's more studies and more proof and more case studies, I always opt for something natural. So for me, that would make perfect sense to do something that's generated from my own body to do some type of facial aesthetic. I just feel that it seems a little more natural, if that makes
Very,
sense.
very
Yeah.
natural, less side effects, no downtime. Yes, and it's your own body. There's nothing, no toxins, no chemicals out there that you're injecting into yourself or putting in your body. So.
Nice. So if somebody were to do a facial, what would you suggest? How many times would they need to come back to repeat that process?
So there is no definitive interval, but I think any healing process in the body takes about 6 weeks. I would
Okay.
recommend once every 3 months, maybe for about a month, to have some facial rejuvenation done. Maybe at the end of the year, I think you probably will see a great improvement in your overall skin texture, the tone, the complexion, and wrinkling.
Nice. We all want to be saved from those wrinkles, Dr. Pattem.
Yes.
It's interesting, living in Florida, worrying about the sun and using sunblock and always being conscientious about, not getting too much direct sun. But at the same token, we're living in Florida, but we're still vitamin D3 deficient. A lot of people, I heard you mention that before. Is it because as we age, our body doesn't synthesize the D3 like it used to when we were children, or what would be that reason?
I think again, probably lifestyle. How much are we being exposed to this sun too? And then the nutrition that we are eating is probably deficient. We're not really getting all the required nutrients. The foods that we're eating, the crops, the way they're growing, the need for overproduction with increasing population is not giving the shortening of the crop length. I think all of these are causing decreased nutrient dense foods and the lifestyles. We stay indoors. I work like from
Yeah,
8 to 6 in the office. I'd never get a ray of sunlight onto my body. So where do I produce it from?
this is
I think it's
true.
probably the story of every other American.
And I also hear doctors recommending D3 with the K2. Why is that? Why should we supplement D3 with K2?
It improves absorption.
Oh, okay. Very good. It improves the absorption. That makes sense. We want to absorb. We want to take something, and we want it to absorb into our bodies. Doctor, we actually have 1 minute left. This has really gone by really quickly. If you wanted any last minute takeaways you want to share with the audience, and you want to let anybody know, please, now is your time to share with everybody.
So I would say stay healthy, stay happy, be conscious about the choices you take, exercise regularly, use a good amount of sunblock for anti-aging purposes, and also to kind of prevent any sun-induced cancers, and stay hydrated.
Oh, very important. Stay hydrated. Absolutely. Thank you so much, Dr. Pattem. She can be reached at 175 Tony Penna Drive, Suite 101, Jupiter, Florida, 33458. Phone number there is 561-746-2033. The website is www.jupitergardensprimarycare.com, info@jgpcp.com. Thank you, everybody, for tuning in. I am your host, Louise Gomez, and we will see you next week for another episode of You and Your Doctor. Thank you, everybody.
Thank you.
Take care. It was
Thank you for letting us share with you